presentation, we will explore the positions of the joints and muscles in the thoracic limb, in the equine and in the rider. The equine has relatively upright forelimbs, which are configured to flex and with gravity assisting with much of the extension of the thoracic limbs. The pelvic limbs are a mirror of this configuration and flexed in readiness for extension to produce much of the power required to create the stride. All four limbs utilize a stretch recoil mechanism formed from the fetlock joint and substantial flexor tendons, and to a lesser extent the shoulder and elbow joints. How the horse places its limbs underneath it forms the base of support. So narrow, wide, short, long. There are no muscles below those joints and they are entirely passive and thus readily strained or fractured if the horse loses its footing, for example. Efficiency of limb function is dependent on optimal foot balance. Lameness is frequently determined from compromised limb health and seen as a head nod when the limb makes ground contact and the thorax moves over the uncomfortable limb. The pelvis will be hiked in hind limb problems to be shown as same side head nod as the horse seeks to transfer the weight off the affected hind in trot. More about this in the biomechanics module, but bear in mind how much limb health is connected with usefulness. Fetlocks will sink less in the affected limb, and bilateral lameness, where both limbs are affected, is very difficult to detect, and this is why it's important to know your breeds so that you can see what you expect to see when trotting up. Again, more about this in a later module. A sway response test is useful for evaluating neurological health, usually carried out by the horse's vet. The horse is led and the vet will pull the tail moderately to unbalance the horse behind. The normal horse will quickly rebalance and recover. The compromised horse will take more time to regain its balance. Some may even fall. A battery of conformational weaknesses can be attributed to the limbs, which will be covered in a later module, but some common anomalies are toe in, toe out, forging, where a front limb shoe can be struck by the toe of the hind limb, overreaching, plaiting, dishing. And much of these can be seen in young horses or those new to ridden work, so improvements are possible as work progresses and the posture improves. Surfaces impact on stride development as well as muscle development. It is counterproductive to work the horse in deep going for extended periods. Muscles can become strained, particularly back muscles, if the horse has to make too much effort without rest periods. Muscles dictate postural position. For example, an immature foal-like stance can be observed as toe out with elbows close together and the horse leaning over its thoracic limbs, looking somewhat unbalanced. Also, the withers can change position significantly as the horse engages in more thoracic sling strengthening work. And this can have implications for saddle fit in the wither region. How the horse loads its body weight will be revealed in hoof shape, and this can be masked by shoeing. Flares will indicate that the horse is loading away from that area of the hoof, for example, and allowing the flare room to develop. And an upright boxy foot typically indicates excessive loading of the toe, leaving the heel to lengthen and form an upright hoof capsule. Touched on in an earlier presentation, laterality of loading preference can produce a low heel in the offloaded forelimb and a high heel in the loaded limb, together with asymmetrical scapulae. Weaknesses in limb muscles will produce an asymmetrical or compensatory gait, resulting in poor performance, or a horse that is not performing true to its type. It's just as important to maintain limb muscle health as it is to maintain back and neck muscle health. Before we explore the muscles of the equine limbs, let's consider the rider. And the rider's limbs and how they use them affects performance in equitation, although many Paralympic riders are an outstanding example of how there is in fact more to influencing the horse in equitation than the use of all limbs in coordination. And what we can learn from this is that if the able-bodied rider is to use their limbs for riding, they must be used in a coordinated way so as not to interfere with or inhibit the horse. Most riders, especially unskilled riders, have a tendency to do too much. The homunculus model of human brain function is an excellent illustration of how much brain space is allocated to the use of the hands and the mouth. This is the sensory model, showing that the hands, mouth and the feet are ranked high in the brain's need for hardwiring, but for the motor control we can see that the hands have an even greater representation. The rider thus needs to consciously control and quieten the use of their hands so as not to disturb the horse, who conversely has a highly sensitive mouth for grazing that could too easily be negatively impacted upon by unempathic use of the rider's hands. So it's easy to appreciate how distracting for the horse's brain this can be. Position of the stirrups plays a major role in the rider's leg position against the saddle in terms of a secure posture for balance. And Mary Wanless advocates a 45-degree angle made with the thigh and the lower leg as the ideal leg position and formation of an efficient lever for equitation. If the stirrups are too long, the unskilled rider will be unstable. If too short, they will find themselves more likely to be positioned in a chair seat. And careful positioning and use of the thighs will facilitate spinal support from the pelvis. And likewise, optimal intrinsic shoulder positioning over the pelvis will provide greater spinal anchoring and support to reduce aberrant arm movement. Let's now explore the locations of the limb muscles of the equine. There are 27 muscles in the equine limbs that I'm going to help you identify. So as I run through them, don't panic about trying to remember names for now. I'd like you to be mindful of muscle function in relation to how they are positioned on the limb so that you can have an educated guess at why they might be limb flexors, extensors, adductors, abductors or stabilizers in any given moment, and also consider which muscles would operate as reciprocal pairs, but we'll cover that in more detail in the biomechanics module. And your memory retention and recall will become much more fluent when you begin to identify these muscles individually on a live horse. So let's first look at muscles with insertions in the humerus, and recall that red muscles are extensors and green are flexors, and yellow have dual roles or some other function that is not flexion or extension. And also recall that these diagrams represent visual aids to help you learn muscle origins and insertions, to indicate their actions, and as such are not entirely precise as they appear in the body. Inserting in the humerus are infra and supraspinatus, originating in the scapula and inserting on the proximal humerus to flex and extend the shoulder joint. This is assisted by teres major with its origin on the caudal scapula, that's at the back, an insertion on the medial humerus at the same site as latissimus dorsi to assist with flexing the shoulder. Subscapularis originates on the medial surface of the scapula, so underneath as you look from the side, and inserts on the medial humerus. It extends and braces the shoulder joint, and consider this as an important jumping muscle as the horse clears and lands from an obstacle, or if the horse misplaces the forelimb due to the ground surface. Deltoideus, or commonly referred to as deltoid, originates on the spine of the scapula to flex this way and abduct, so outwards away from the body, the forelimb. And consider when stretching a forelimb that this muscle requires positioning across the midline of the body to fully stretch it. Pectoralis muscle group, or more commonly the pectoral muscle group, with three components: ascendens here, descendens, and transverse, which tracks from the humerus across to the midline. And this forms the ventral attachment and supportive structure of the thoracic limb. It looks like the ascendens descends and vice versa for descendens, but think of them as originating from the sternum, both upwards and downwards. Then they'll be easier to recall. Action of the pectoral group is adduction of the forelimb. And given that this is a forelimb stabilizer, careful evaluation of this muscle reveals clues as to the state of foot balance. And this muscle can be atrophied or acutely reactive to touch, and because it's largely hidden, it is easily overlooked during evaluation. Now with muscles with insertions below the shoulder joint. Biceps brachii, with its origins on the distal scapula and insertions into the cranial radius, is biarticular, meaning that it has two joint actions. It extends the shoulder joint and flexes the elbow joint. Again, another important muscle for clearing and landing over jumps. Brachialis spirals laterally from the medial or the inside of the humerus to insert on the cranial radius and flex the elbow joint. And coneus is a small muscle that crosses the elbow joint to assist with extension. Triceps is another biarticular muscle and acts to flex the shoulder joint here, so this way, and extend the elbow joint this way. Again, another very important muscle group involved in jumping, and it's nearly always possible to tell how a horse is progressing with its jumping technique and training by palpating this muscle and how reactive or sensitive it is to the touch, without even knowing in advance whether or not the horse has actually been jumping recently. And consider that when the limb makes contact with the ground, this muscle is directly involved in retraction and will therefore influence the quality and the length of the stride. Muscles with insertions below the carpus are primarily flexors and extensors, and all are multi-articular. There is no benefit to the equine fleeing from a predator at high speed to be able to rotate its limbs. It's only the tendons of these muscles which extend below the carpal joint, and the carpus and its structures below it are therefore wholly passive, influenced only by tendinous levers with ground placement, contact, and operated by the stretch recoil mechanisms of the fetlock joint and, to a much lesser extent, the shoulder and elbow joints. With this configuration, there is greatly reduced muscular control in the distal limb, leaving only the tendons and the ligaments to provide support. Let's take a look at the lower limb extensors in the equine, which are positioned cranially or laterally on the leg. Extensor carpi radialis operates the humerus, crossing the shoulder joint to insert just below the carpus. Extensor digitorum communis takes the same path but continues all the way down to cross the fetlock joint and pastern joints to insert in the cranial pedal bone, hence why it is known as the digital, meaning finger or toe extensor. Extensor digitorum lateralis, or lateral extensor muscle, tracks down the outside of the limb, crossing the elbow and carpal joints laterally, then tracking cranially to insert in the front of the long pastern bone. And extensors tend to be assisted by momentum of the limb as it moves forward. So the tendons are not as substantial as for the flexors, notably the superficial and deep flexor tendons, which we'll look at shortly. And there is much more tolerance of extensor tendon injury than of flexor tendon injury for this reason. The lower limb flexors are positioned caudally at the back, laterally and medially to almost surround the leg as they work against gravity to produce the stride by extending the elbow and flexing the carpus in a double catapult mechanism. Ulnaris lateralis originates on the lateral humerus and tracks down the lateral limb, crossing the elbow and carpal joints and inserting into the accessory carpal bone and the splint bones. Flexor carpi radialis originates on the medial side, shown here in light green because you can't see it from this angle, and it tracks caudally at the back to insert into the medial or the inner splint bone, the second metacarpal bone, again seen here in the lighter green to signify that it is medial. Deep and superficial flexor muscles with their associated tendons typically tend to be referred to only as tendons. The superficial flexor muscle and tendon, flexor digitorum superficialis, originates in the medial humerus, again shown in light green because it's not visible from this lateral view, tracks down the limb caudally at the back, bifurcates, so it splits into two at the fetlock joint where it contains two sesamoid bones acting as a double fulcrum, and both elements insert into each of the medial and lateral sides of the long pastern bone. And there is an additional structure attached to it just above the carpus, which is a check or accessory ligament acting as a protective force dampener. The deep digital flexor muscle, the flexor digitorum profundus, originates in three branches from the humerus, radius and ulna. Here, humerus, radius, ulna, and tracks down the back of the limb to insert on the pedal bone. This also has an accessory ligament and it is sited just below the carpus. Let's take a look at the thoracic limbs in action in this video. Supra, infra and deltoid, and triceps just caudal to that. Subscapularis emerges over the shoulder joint here. Biceps is relaxed in reciprocation with triceps. Latissimus emerges from underneath the humerus. The ascending and part of the transverse pectoral muscle is visible here. And note the stretch recoil action of the fetlock joint. And this thoroughbred has very well developed pectoral muscles. Note the definition of the extensors contracting to protract the limb. Extensor carpi radialis here, long and lateral extensors. And the flexor muscle, ulnaris lateralis. On the other limb we can see flexor carpi radialis and the superficial and deep flexor muscles in this region. And recall that the muscles are positioned above the carpus, tendons below. This grey horse has a right limb misalignment which demonstrates how important it is to maintain balanced hoof trimming and associated muscle balance for optimal placement on the ground. This is landing laterally on this limb here and medially on this limb. And just note the misalignment. The pectoral muscles adduct the limb towards the midline this way. And much of the weight seems to be loading through the medial carpal joint. And this young horse would need to have this addressed before starting fast work, or the issue could be exacerbated at speed. See the misalignments there, very immature. And the amount of adduction through the stride. To test, just gently take the limb through its range of motion stretching forwards and retracting add abduction to this sequence. And now the arm muscles of the rider. And you will note that in the rider, deltoideus is more extensive, here the brown muscles, since the rider's shoulder has a far greater range of motion compared with the horse, and deltoid thus not only plays a large part in the production of that motion, it must also contribute to stabilization of the shoulder joint. The deltoids originate on the spine of the scapula and clavicle, inserting on the upper lateral humerus to raise the arm to the front, the side and rear of the body, or to be more precise, abduct the shoulder when all the fibers contract, and flex the shoulder when the anterior element contracts, and extend the shoulder when the posterior element contracts. And by now you should be firmly getting the idea that joint action depends on orientation of the fibers where they insert on the other side of the joint. The pectoral muscles are labelled as major and minor in the rider, minor being deep to the major, so underneath it. Originating on the sternum, they insert into the medial humerus to adduct the arm. You can see how tight transverse pectorals in the rider will cause their shoulders to become rounded. The biceps here and their reciprocal triceps at the back of the arm are important in terms of degree of forward or backward contact with the reins. So relaxing the biceps will facilitate a more forward contact, which is more comfortable for the horse. Extensor carpi radialis controls hand movement on the reins together with flexor carpi radialis, and both of these muscles determining whether the hands will be held outward or inward through the wrist joint. Triceps are here. Latissimus dorsi is positioned on the back and inserted into the humerus to draw back the arm in this way or this way. In the next presentation, we will explore the joints in relation to the muscles of the pelvic limb.